Live now to the Queensland Health Authorities with the latest on COVID-19.
Queensland hospitals, 12 of those though are serious. They're in intensive care and currently receiving ventilation. To put those numbers in perspective, the 9 overnight brings our total for the week, our 7-day total, to 77. When I spoke to you last Saturday, it was 274. The Saturday before that, it had peaked at 380. And so we have seen in just 2 weeks a very dramatic decline in the weekly average number of cases. It's now 5 days since we relaxed those testing criteria to do more community testing where we thought there could have been community spread on the Gold Coast, in Brisbane and in Cairns. And I'm really pleased to report that we haven't seen an increase in positive tests. In fact, the number of positive tests have continued to decrease over that time. The number of tests per day had dropped to roughly 600 from a peak of around 3,000, and then it's now back up over 2,000. We did 2,149 tests overnight. Considering that number of positive is just 9, that is a positive testing rate of just 0.42 over the last 24 hours. Incredibly low by global standards. The announcement we are making today will prepare us, though, for the future of this pandemic. It's incredibly important that we empower all of our health workers to support our health system throughout this, and that is our health workers in our hospitals, but also our health workers in the community, and our community pharmacists and pharmacy assistants and their staff are incredibly important all the time, but even more important as we face a pandemic. We have in recent years expanded the range of services that pharmacists can offer, and today we're announcing that we are amending the state's drug therapy protocol to do a few things: to allow pharmacists a wider range of options for emergency medications so that if people can't get to their prescriber, they will be able to access emergency medications, to widen the circumstances in which pharmacists can substitute medications, but most importantly, we are amending our drug therapy protocol so that pharmacists will be able to, when we have a COVID-19 vaccine, deliver that vaccine. That means that communities right across the state, everywhere in this state, will have very quick access to the vaccine when it comes. And we are very confident that we will one day have a vaccine, and it will be incredibly important that we get that vaccine out as quickly as we can, that we vaccinate as many people as quickly as we can, and by using our network of community pharmacists, that will be the fastest way to get that vaccine out and help keep our Queensland community safe.
Thank you, Minister. And the Pharmacy Guild of Australia would just like to thank the Palaszczuk government for making this move to keep every Queenslander safe. These drug therapy protocol changes will mean that 6,200 pharmacists and 1,150 pharmacies across Queensland will provide enhanced healthcare access to all Queenslanders. These will be instrumental in protecting Queenslanders, especially those at risk, those who are self-isolating at home, those who are over 70 or have a chronic illness will be able to receive enhanced healthcare access due to this announcement. Having a greater scope of supply of medicines in this pandemic time is crucial to quick rollout and prevent spread of the virus. We acknowledge that when a virus becomes available, this will need to be rolled out quickly, and using the pharmacy network is a way to do this.